After many deaths, the health response to the cholera outbreak in Cameroon is bearing fruit. The cholera unit at the Buea Hospital has seen an influx of cases in recent weeks. According to the director, the situation is stabilising.
Yeah, the situation here is getting stabilized. We've had many cases, approximately 350 cases cumulatively of patients who've diagnosed and treated for cholera. We've also had approximately 6 deaths from cholera out of the 350 approximately. Presently, we have about 9 hospitalized patients because we just discharged some of them this morning.
While the cholera pandemic situation seems to be improving here in Buea and the southwest regional capital, towns like Limbe and Tiku remain in the spotlight with nearly 100 new infections, as announced by the Cameroonian Minister of Public Health in a tweet between March 25th and April 5th. If Buea is beginning to have some respite, this is not the case here in Tiku, where the majority of beds are still occupied. Despite the downward trend, patients are still flocking in. As for the disease, it persists because of the population's denial of its very existence.
Initially, many persons were for the fact that cholera really does not exist. But when the epidemic got hot, not just here in Tiku, when we had cases reported dead from Buea and Limbe, people were forced to believe that truly cholera exists. Some persons were even opportune to come over to the treatment center. They saw their loved ones passing out stools, vomiting. They were really forced to believe that cholera really exists.
Another cause is the glaring lack of toilets and drinking water for the population.
Generally, it's due to poor water and sanitary conditions. The state of the toilets is really not the best over there in Likumba and other places around Tiku. Some people don't even have toilets. You find people passing out feces in streams, and others are dependent on the same stream for drinking and all. So it's really so bad.
On the ground, health workers are working with the population on awareness raising, education and vaccination. Cumulative cases since the beginning of the epidemic show 4,627 patients and 105 deaths.